Now, more than 1 million Brits are currently on weight loss jabs, but this has led to a surge of potentially dangerous tips that speed up the process. I don't know much about this.
Well, you're going to find out all about it. So can you really hack your weight loss drugs without putting your health in harm's way? Well, Dr. Hussain joins us right now.
It's good to see you, Doctor.
So good to see you. I mean, we've got to face facts. A lot of people are on these weight loss drugs, aren't they?
Yeah, it's estimated around 1.5 million people in the UK are on these weight loss medications, so it's becoming more and more common.
Yeah.
And so people are looking for advice and support.
And, Doctor, most of those people are either diabetic or pre-diabetic, so...
Well, yeah, it depends. Yeah, most of them will have often what we call complications of extra weight, although type 2 diabetes can occur across the BMI range and weight range. And majority of them at the moment are getting it privately because its indication for the weight loss indication in the NHS is still growing, and there's a 3 years sort of phased rollout before we see it being more widely used in the NHS.
So it must be really frustrating for you looking online and seeing so much misinformation, so many hacks you think, oh, that's not right, or, I mean, I've heard of the golden... What is it, the golden...
Golden dose.
The golden dose.
Yes.
I mean, what do you make of that?
Yeah, there's all sorts of stuff online. You know, some of it can be quite good. Some of it can be quite good, especially when they come from medical professionals putting things out online. But a lot of it can be harmful or a bit pointless, and sometimes very dangerous. The golden dose you talked about is utilising the buffer fluid that's in the injection. So in order for the injection to give all of its doses and to make sure that every dose contains the full dose, there's a little bit extra, which is there to be wasted.
Yeah.
People trying to utilise that, and there is no evidence base that that is somehow a golden dose or going to bring about anything. And so we have to be careful.
Well, how would you get that dose out?
Essentially squeezing it out with the sort of the final click, which isn't there, if that makes sense, which just isn't something I would do, because you're now changing the dose, and there's a reason why we give those set doses. Because they've been studied, they've been looked at, whole ranges get explored, and then specific ones get used. And there's a reason why specific dosages are used.
Quite get my head around why there would be hacks, because presumably, I mean, as we've all seen, the weight loss drug, obviously we don't know, like, absolute, like, long-term effects, but it seems to be quite, you know, pretty useful. It seems to do its job. So why would you need a hack in the first place?
Really good question. And look, yeah, they are quite effective. But I think if we change the word hack to maximising and optimising it, that's key, because when we lose weight, the kind of weight loss we get can differ hugely. It depends on what you're doing while that weight loss is occurring, and also how quick that weight loss is. So, for example, if we lose weight really quickly, we're much more likely to lose fat-free mass, for example, muscle, rather than just fat mass.
And we don't want to do that.
We don't want to do that.
Why is that? Is that just because
muscle
goes first?
Is like, if there's one currency when it comes to health, it's muscle, because it's useful for us to do our daily activities, especially as we get older.
Yeah.
It's also really metabolically active. Think of your muscles as storage centres for your energy. So if I have someone that eats a meal, let's say, with very minimal muscle mass, compared to someone that eats a meal with decent amounts, the individual that has a lot of muscle mass has lots of car park spaces for all this energy that they've consumed to go into, rather than it be stored as fat. While someone with minimal muscle mass, when they eat a meal, there's nowhere for it to go.
Yeah.
Which is why heavyweights helps you lose weight.
Yeah,
in a weird way, right?
Yeah, doing weights and having good amount of muscle, it's really resistant when it comes to putting on weight. So if someone's going to lose a lot of weight utilising these injections, if you want to stop regaining the weight quickly, you need to try to have an eye on your body composition rather than the scales.
Yeah.
Because the scales give only one side of the story.
Sure.
So you want a good amount of muscle mass to protect you from that weight regain. In fact, one study...
I know, I'm doing my best.
Absolutely. One study compared it that looks at groups that were using resistance training compared to those that didn't while taking the injection. And the group that did use resistance training only gained 2 kilos over the year after stopping, while the group that didn't gained 6.5 kilos.
Well, there you go.
So significantly
Can we go through some of these hacks and see whether they're true or not? So is it true to eat less? So basically, eat less. Less is more.
Less is more.
Yeah, like really strict diets while taking it. Yeah,
while taking it, you just go really, like, low calorie.
Yeah, it's a good question. And I think the issue here is that injections will reduce your appetite quite significantly. So it can allow many people to eat 800, 900 calories. Now, we don't want to make that more severe because, as I said before, rapid weight loss often reduces the quality of the weight loss. It also puts you at greater risk of adverse effects like pancreatitis, like loss of muscle mass, like loss of bone density, really important for women as they go through the menopause, Like, for example, issues with nutritional deficiencies. We're starting to see case reports of patients with things like scurvy and other vitamin deficiencies. Yeah, because if there isn't an alteration in the diet and we ensure that you're eating a good quality, lower calorie diet, then you can run into those kind of risks. So it's so important to make sure that you speak to a professional to support you when it comes to the kind of nutrition that you put in. We want to really try and prioritise the foods that we do eat in that lower calorie diet.
Talking
so
of
interesting,
foods,
isn't it?
prunes, any good? Yes or no?
Do you know what, prunes? Yes, I would give that the tick because one of the side effects of these injections is constipation.
Oh, right.
Prunes, they contain a good amount of fibre, that will help with that. But they also contain a whole range of micronutrients that are going to be vital. So when I think about that reduced diet that someone's eating because of the appetite suppression, I want it to be heavyweight when it comes to bringing all the nutrients, minerals, vitamins. So, yeah, things like prunes, but also think wider than that.
Water.
I want your shopping... water will definitely help with that, but I want your shopping trolley to be colourful because the colours that you get in vegetables, fruits, they will all bring a different nutrient to it. It's a nice rainbow diet where you...
I mean, some of my mates that are on it, I worry about them because I don't know if they're getting enough like food and nutrients that their body needs during the day. Yeah. So people are talking about the OMAD diet. That's one meal a day. Is that, just lastly, do you think that's a good idea or a bad idea?
It's kind of a form of intermittent fasting, and it's something that if someone feels that it fits within their lifestyle and they're not on the injection, that can be OK. But putting it together with the injection where you have severe appetite suppression, that wouldn't be my way to go because, in fact, we know that bigger meals often causes more nausea and vomiting in patients on these injections. It's better to take small meals more often and to look to reduce the dietary fat component because that can trigger a bit more nausea as a reaction. So thinking about changing the diet to more small and often rather than one meal a day.
So basically, the jab is a tool, isn't it? You've got to still eat healthy, you've got to still exercise, you've got to drink water, and you've got to be good.
Exactly. To get the most out of it, do those things.
Yeah.
Because you want to have long-term results. You don't want to just see results for the year and then regain it. You want to have better quality weight loss.
Thanks, Dr.
Hi, everyone. Just wanted to say thank you for visiting our This Morning YouTube channel. Now, listen, we upload new content every day. So go ahead and hit that subscribe button so you don't miss out. And we'll see you in the morning.